right, good afternoon and welcome to the September 24th Community Update. My name is Stacy Wood and I serve as a Public Information Officer here in the Emergency Operations Center. This Community Update is available in Spanish on the Buncombe County Health and Human Services Facebook page, and that can be found on Facebook at BCHHS. And as a reminder, all of these community updates can be found on the Buncombe County Government YouTube channel. So let's go ahead and get started with an update provided by Stacy Saunders, Buncombe County Public Health Director.
Thanks so much for joining us this afternoon. We'll start out like we usually do with an update on our local numbers and indicators. As of today, there have been 2,977 lab-confirmed cases of COVID-19 in Buncombe County residents. We as a community have experienced 83 COVID-related deaths. Our community has administered 70,981 COVID-19 tests. We continue to see about 4,000 tests administered throughout our county each week and have seen that throughout the last few months. This is a collaborative and committed effort of community partners and providers throughout our county to provide access to testing. You've heard me say it before, these testing efforts help us not only identify those with active infection, but also help us better understand the level of spread of the virus in our community. According to the North Carolina COVID dashboard, the statewide percent positivity is now below 5%. Today's percent positivity for North Carolina is 4.8%. Our current percent positivity in Buncombe County is now around 2.3%. We have seen this indicator decrease significantly over time for our community. We also continue to see an overall decrease in new cases per day on average. Our current cases are remaining under 20 new cases per day, and most current data shows we are seeing about 18 new cases per day on average. Thank you so much for your commitment to slowing the spread of COVID-19 in our community. We see that commitment in our indicators and want you to continue to practice the 3 W's each and every day to help stop the spread. Maybe you've heard that there is a new tool available to you by North Carolina Department of Health and Human Services to help stop the spread of COVID-19. North Carolina Department of Health and Human Services launched the COVID-19 Exposure Notification app, Slow COVID NC, this week. The Slow COVID NC app quickly notifies you if you have been exposed to COVID-19, allowing you to reduce the risk of illness for you and your loved ones by providing you with North Carolina Department of Health and Human Services recommendations on how to self-quarantine and when to get tested. As we cautiously begin to reopen parts of our economy and increase the number of people who can gather, this app could be especially helpful in detecting possible exposures. Slow COVID NC complements traditional contact tracing performed by public health because it can notify individuals when they have had an unknown community exposure of COVID-19. This app would be beneficial for people who are in settings where social distancing is hard to maintain, or you are coming in contact with many different people at larger events, such as civic or sporting events. For those interested in the app, participation is voluntary, and you can begin downloading the free Slow COVID NC Exposure Notification app from the Apple App Store or Google Play Store and enable Bluetooth and exposure notifications. If you test positive for COVID-19, you may obtain a unique PIN to submit in the app. This voluntary and anonymous reporting notifies others who have downloaded the app and were in close contact with you that they may have been in close contact with someone in the last 14 days who has tested positive. It then lets the contact know about self-quarantine and testing. Use of the app is completely voluntary, and more information on how it works can be found at North Carolina Department of Health and Human Services website, covid19.ncdhhs.gov/slow-COVID-NC. So let's talk a little bit about testing. If you are having symptoms or feel like you have been exposed to COVID-19 regardless of symptoms, please get tested. I say it every week, testing is important. Testing helps us quickly identify active infections, which helps us slow the spread and protect you and our other neighbors. You can find testing locations near you by checking out Find My Testing Site website. You can also schedule an appointment at one of our county COVID-19 community testing sites. Visit Buncombe County Self-Checker at buncombeready.org to complete the screening tool. You can also complete the self-checker over the phone by calling 828-419-0095 from 8:30 to 5, Monday through Friday. If you meet criteria, you will then complete the registration and afterwards receive a call from the Ready team with your appointment location, date, and time. Remember, there is no cost at our community testing sites. If you have insurance, it will be billed to cover the cost of the test. Spanish medical interpreters are on site at each community testing location to assist those who need it. More information about COVID testing in Buncombe County can be found at buncombeready.org. This is also a really good time to remind everyone that if you are having symptoms consistent with COVID, you should not go to work or school. Going to work when you are sick puts others at risk. Some of these individuals you are around could have underlying health conditions or other risk factors that put them at risk for severe illness. You should stay at home and seek testing through your healthcare provider, urgent care, or a community testing site. Once you are tested, you still need to stay at home until results are back and you receive next steps. Remember, even if your test is negative for COVID, if you have symptoms and are not feeling well, you should stay at home. We are entering flu season, and a negative COVID test is not a free pass to resume activities. Speaking of flu, now is the time to get your flu vaccine. With COVID-19 circulating in our community, getting a flu vaccine is more important than ever to protect yourself and the people around you from flu, and to help reduce strain on healthcare systems responding to COVID-19. As you know, flu is a serious respiratory illness and can sometimes be deadly. Flu vaccination is recommended for everyone 6 months and older. Contact your healthcare provider, local pharmacy, or our immunization clinic for more information about flu vaccine or to schedule an appointment. And I can't end today without reminding everyone again of the importance of the 3 W's and limiting your interactions. Please continue to help us fight COVID-19. Get behind the mask, whatever your reason. Wash your hands often. Stay 6 feet apart. Do it for yourself. Do it for your loved ones. Do it for your neighbors. And please get your flu vaccine. Thank you for your time and attention today. Take care and stay healthy.
Today is our last Thursday briefing, and this marks our 50th community update since the COVID-19 response started. We are grateful to the efforts of those involved in bringing these community updates to you. We'd like to say thanks to our American Sign Language interpreters, Ashley and Regina, and thank you to Senzatle Language Justice Cooperative for simultaneous Spanish interpretation. Thanks to the many staff that have worked to make this update happen, especially the person behind the camera and computer, Max Tainer, who keeps everything sanitized and in working order around here. And thank you to our media partners who have been instrumental in covering COVID-19 here locally with accuracy and fairness. We appreciate your efforts to keep our community informed. So unless there is a major update for the community, updates on the COVID-19 response, will now be provided at the Board of Commissioners pre-meetings that happen on the first and third Tuesdays of every month at 3 p.m. On the off weeks, the Emergency Operations Center will provide an update for media to send their questions in for a response that will be sent back out to all media partners. We will continue to provide COVID-19 related stories and experiences through the Let's Talk COVID series. Again, please know that we stand ready to hold community updates in the event that there is a major update to report out to our community. And we want to thank all of you for your support of the briefings and for caring about what happens locally. And as always, you can continue to find the most up-to-date information on COVID-19 in Buncombe County at buncombeready.org. And so before we part ways, here are some important action steps that we need our community to take. Complete the census if you haven't already. The deadline is here. Visit census2020.gov and take 10 minutes to complete the census today. Get a flu shot. If you haven't gotten a flu shot in the past, for whatever reason, now is your time to shine. Get a flu shot wherever you can. If you have questions, you can call our immunization clinic, and that number is 828-250-5096. And vote. Information on voting in Buncombe County can be found at buncombecounty.org/vote. Again, thanks for staying engaged and for helping to share accurate information on COVID-19.